Hi, happy Acupuncture Medicine Day. Thank you for joining us as I talk with Dr. Fennell and Dr. Lee from the VA. But before we get started, I'd like to introduce myself. I'm Anne Marie Sanders. I'm a student here at AOMA. I'm at the beginning of my second year of the master's program, and I'm extremely excited to be having this conversation with Dr. Lee and Dr. Fennell. So let's get started. First, it would be great if you each could introduce yourselves, as you come from very different backgrounds and bring unique perspectives to integrated care and acupuncture, but you both hold roles in the VA, overseeing the VA's whole health programs in South and Central Texas. How did each of you arrive at a similar place in the work of transforming healthcare?
I'd like to hear from Dr. Fennell first, to be honest, because I haven't heard the whole story myself.
Sure. So I'm Dr. John Fennell. I'm the program manager for whole health at the South Texas VA. And I started out getting trained as a naturopathic physician and acupuncturist in a dual degree program, and then went on to get additional training through NIH, National Institutes of Health, both pre-doctoral and postdoctoral research training, and continued my work actually at AOMA Graduate School of Integrative Medicine. So I was program director there of the doctoral program for 6 years, at which time I had met some of the players at the VA in South Texas as they were being designated as one of the flagships for whole health. We began some interesting discussions and collaborations there, one of which was an NIH research grant, giving me additional training on non-pharmacological approaches to pain. It was at that time that they approached me to come on as the program manager. And interestingly, the focus of whole health, it is more of a kind of an integrated approach to whole health. I almost look at it as kind of public health medicine, because we're really looking at all the determinants of health and kind of changing that conversation from what's the matter to you to what matters, or what's the matter with you to what matters to you. And so I feel very fortunate to have gotten the position, but I also feel like all of my training up to now has led to me doing this work at the VA.
Great.
Dr. Lee?
Thank you. Yes. Well, I started out through allopathic medicine, but I've always had an interest in integrative and integrative medicine, and particularly East Asian medicine. So I went to the University of Pittsburgh for medical school and stayed there for my residency in internal medicine, and then went straight into the VA from there. I saw a large need for more people addressing both chronic pain and substance use disorders. So I started rounding with the substance use disorders teams, and over time we were able, when I was doing this at the time, there was no fellowship training programs for this, but there was the American Society of Addiction Medicine and a board of addiction medicine. So I took the board exam and became board certified. I've been maintaining that as well. And then a few years later, I started studying acupuncture through the Helms Medical Institute. That's the program that most physicians who practice acupuncture start their training with. And people have very different trajectories from there. Some people go and do a master's in East Asian medicine, or they do a very neuroanatomic style of acupuncture, and anything in between. So there's tremendous variation there. Let's see. So as I started doing the acupuncture, bringing the acupuncture into the VA there in Pittsburgh around 2007. And a few years later, the VA had this pain management directive. That was 2009, I believe. And of course, that was to address the opioid crisis. And one of the main strategies that was recommended was complementary and integrative approaches when available or where available. And another requirement was that every visit, or integrated service network within the VA, had to develop a pain rehab program that got CARF accreditation. So I was tasked to do that in the Pittsburgh VA. We got our accreditation, I believe in, I want to say 2013, and then re-accredited just before I transferred from Pittsburgh to the Salisbury, North Carolina VA. As Dr. Fennell was saying, the VA designated flagships, one for each VISN, and in Salisbury, in North Carolina, or I should say VISN 6, that was the Salisbury VA. So I helped build that program for about 2.5 years when this position was created in Central Texas in Temple. I thought this was a great opportunity because they developed it as a separate service line rather than putting it under a different service. For instance, many places have it under primary care or rehab medicine. But by having it as a separate service line, I feel like we have a little bit more access to other services. Just a moment. Okay, I apologize. Give me one moment. So, I was saying, by having it as a separate service line, we're able to have more access to leadership, both at the executive level and other services, so that we can try to collaborate on implementation of whole health. And as Dr. Fennell was saying, it's not just about integration, integrative approaches. Acupuncture, Tai Chi, yoga are certainly wonderful tools that we can offer for the veterans, but it really is about that shift in the culture of how we practice medicine. It's not focused on the diagnosis, but rather focused on the person. The interesting thing is that orientation actually is pretty old news, even in conventional allopathic medicine. Osler is known for a quote essentially saying that it matters less what is the disease, but who is the person with the disease. Paraphrasing, I don't recall the exact words. Now, I think I've veered off topic from who I am to what I think, so I'll go ahead and turn it back to you. I appreciate it.
Okay, the second question. The VA Whole Health Integrative Care Model is held out as one of the best examples of true integrative care. First, would you define integrative care for our audience? And secondly, what differentiates the VA's whole health model from other integrative care models? Dr. Lee, would you like to go first?
Sure. I guess I already started talking about that a bit, and actually Dr. Fennell did as well. The integration that I think of is on a couple of levels. It's certainly integration of the complementary integrative health approaches, as we were listing them. In fact, the VA has required all facilities to offer 9 of these approaches to all veterans. If I can try to list them off, that would be acupuncture, Tai Chi, yoga, massage therapy, chiropractic, biofeedback, guided imagery, meditation or mindfulness approaches, and hypnosis. I believe that's it. So yes, we want to make these available, but we don't want to use them in a prescriptive type of way. We're not going to say, well, you know that your condition responds really well to this approach, so you should really do that. It's more about, these are your options. Some people find them useful. Sometimes it's a question of whether they appeal to you in terms of your values and so forth. So that's one level of integration, but it's also about integration across disciplines, and not just between these approaches and allopathic care, conventional care, but rather even within conventional care, we have this phenomenon of siloed care, so that one specialist might make one recommendation, and then you see somebody else, and they may make similar recommendations, but you may have to decide, well, what's the priority here, or are there concerns that by focusing on this one thing that you're neglecting another. So we really want to integrate in the sense that looking at the person as a whole rather than the collection of diseases. Because what happens with that is people accumulate prescriptions, and I have seen people as many as 20 or even 30 prescriptions, all addressing separate conditions, or multiple prescriptions for a condition. And yet, unfortunately, of course, there's the risk of interactions, but it's bewildering for the patient. It's very frequent that they don't know what this cocktail of medications is for necessarily. So again, coordination or integration across these services, including the integrative and complementary approaches. And the third level, I would say, is that we're talking about integration of the human being. And that's very much consistent with traditional East Asian medicine, mind, body, and spirit being treated as a whole rather than parsing out or separating out one aspect of that, and not considering how each of them influence each other. So.
And I will just say everything that Dr. Lee said, and then I'll add a few things. So when I'm looking at the whole health model, I think when I started out, I was kind of more focused on these inner petals of the program, which are kind of the pathway, which is where we're trying to change that discussion with our veterans from, again, what's the matter with you to what matters to you. In addition, getting them focused on their mission, aspiration, and purpose. Why do they want their health? Why is it important to them? And then starting to set goals around that. And then with those goals, rather than having a specific treatment to address those goals, we're really focused on equipping and empowering them with the skills to manage their own conditions and improve their own health. And so I think that that's a place where like the Tai Chi and yoga and mindfulness meditation, and by the way, Dr. Lee, you did get all 9, so good job. But then we still have our kind of conventional system of care, and that doesn't go away. What we are doing is kind of adding some features to it, such as the acupuncture, which is a very important piece, and it goes beyond just the non-pharmacological treatment of pain. And so, as I said at the beginning, I was really focused on those 3. But if you look at the models for whole health, there are these outer rings, and the furthest out is the community. And I think that for whole health to succeed in the way that the VA has envisioned it, it really has to look at the community, because about 80% of our health is determined by the social determinants of health. It's not determined by what happens in the hospital or in the healthcare system. It's about the world around us and how that affects our health. So in addition to our focus kind of inside our clinical care, we're also focused on building those community partnerships to really change how we live healthfully in the entire community. And I think this will start in the VA. It's already kind of extended into Medicare, Medicaid, with their approval for acupuncture for chronic low back pain and a few other conditions. But when we're really looking at, how to transform the health of the community, we have to look beyond the veterans, because our veterans have families, they have friends, and all of those external influences on them affects their health. And so really thinking now about okay, how do we change the world? So super exciting time.
Yes, it is. Yes, it is. I know you've touched on this already, but acupuncture is a component of your care model. Why? And please share from your perspectives the value of acupuncture for chronic health issues.
Would you like me to go?
Sure.
Okay, great. Yeah, I wanted to say before I speak on that, I really appreciate what Dr. Fennell said. We've been on many conference calls. I believe that we really resonate with each other's worldviews and approaches and ambitions, I would say, in whole health and in the VA. The question about the role of acupuncture in my practice and in chronic conditions, I think it needs to be, once again, a very individualized approach to, well, any health condition, but having it in the armamentarium, let's say, that we have to help people. And once again, it's not so much about trying to fix people, trying to heal them even, but help them heal, help them, in the words that Dr. Fennell used, we want to empower and equip them to be able to do this for themselves. So in acupuncture, of course, we talk about the physiology in that East Asian sense, but we also know that we talk about, I'm sorry, there's a lot of noise in the background. We talk about the importance of the self-management in that setting as well. You know, it's really part of our job in acupuncture to counsel our patients on nutrition, lifestyle, and give them some practices, some tools to use that they can have access to when they leave our office, right? So what I like to think about is that we think when we hear the word doctor, we assume, or many people assume, that we're talking about a physician. But of course, you know, many people have that title for many different professions. But really, I wanted to bring it back to the actual meaning of the word, which is that it's the word means to be a teacher, to teach. So I try to take that to heart with every patient encounter that I have. You know, what can I help? What information would be useful to that person, but doing it in a very respectful sense. We use a lot of we use motivating approaches often in not just in whole health, but many different aspects of our our newer appreciation for the importance of patients' agency and autonomy in their own care. So I apologize. I'm going to put myself on mute. There's a lot of noise where I am right now. So thank you.
And so I think, one, I agree wholeheartedly with Dr. Lee. And when I'm really thinking about acupuncture's role in the VA, and again, when we're discussing, like, well, it shouldn't just be another prescription, or you know, we can collect our pill bottles and we could perhaps even get addicted to acupuncture. But if we're not changing our day-to-day activities, and so with all of my patients, I'm first of all, I kind of qualify or make a qualifying statement and say, like, you spend way more time with yourself than I do with you. And we can have those needles in for maybe 30 minutes or something during a visit, but how do we get you working on Qigong and Tai Chi and acupressure and really teach you to manage your own condition? And so, as Dr. Lee said, the physician or doctor as teacher, I think that does play a huge role. But with that comes this cultural transformation. And it's not just it's multi-tiered, because we have to change the way that we think as clinicians. The system has to change the way that approaches healthcare. But our veterans, they also have to change their perception of what healthcare is. And when we're really saying that, okay, well, this extends beyond the walls of our facility, it extends beyond this hour that I have to spend with you doing the acupuncture, then we really start getting down to the foundations of health, and say, okay, well, you know, staying hydrated, eating right, being physically active, kind of working on surroundings, whether environmental surroundings or whether there are relationships with our friends and family. Are they healthy ones? How do we ensure that they're healthy and nourishing? And then also looking at kind of our ability to manage the stressors of the world, and do we have the skills to do that? So We've been doing this quite a bit during COVID with our employee whole health program. So teaching our employees a few quick skills that they can use throughout the day. If they practice them more and more, then the stressors of the workday are having less of an impact on how they're feeling at the end of the day. Maybe it's improving their sleep. We're teaching them ear acupressure in addition to our veterans. And so really it's giving them the skills. And I think at the end of the day, like we have a large toolbox. And not all of those are the right tool for every patient. So when we're looking at that kind of individualized care, I try to think of it as, doctor as teacher and say, okay, well, we do have all of these tools. What you need to do and your homework is to learn about yourself and learn what works for you and what doesn't work for you. And let's start working with the things that do work for you, and come up with a plan that we can put into practice, because can have you doing the things that you need to do to promote your own health. And one thing is you probably won't need the acupuncture treatment quite as often. And two, it's going to go a lot further. Like when we do that one treatment, it will be transformative rather than me trying to fix the fact that you're sitting on your couch binge watching Netflix or whatever, what other habits you may have. And so it is changing the culture, that cultural transformation that's going to help acupuncture and the practice of East Asian medicine have the greatest impact within the VA.
Great, great. And now for our last question. Since we are celebrating National Acupuncture Medicine Day and awareness of the benefits of acupuncture, when and why would you recommend acupuncture for a patient? Dr. Lee, would you like to go first?
I feel like we've spoken about this already with the previous questions. But yeah, I mean, my approach is simply to learn about the veteran, the person, the patient as a human, and then really I like to ask permission to offer my my suggestions or recommendations on what my own experience is with other people and with myself. But I think once again it's about giving them the information they need to make the choice and whether this will help or not, for them, for their specific unique situation. When you study acupuncture, you do really appreciate the breadth of it, that it's not merely about pain management, but even in that regard, it's a wonderful tool. But yes, there's I'm hard pressed to think of conditions that don't have some acupuncture indication. Not to say that we can fix everything, of course we can't, but can we assist a person's well-being, their robustness, their resilience? Certainly. And is it because of the needles or the point selection? It's hard to say for sure. Studies on each one of these conditions. But really, for me, it's more about that relationship, that rapport that you build with the patient. Having the tradition gives me the confidence that I'm doing something that my mentors and their teachers have relied on. But more than that, if I don't have that rapport with my patients, nothing's going to change, I don't think. And in some cases, I might say, kind of what Dr. Fennell was saying, I can help with this particular symptom. And that may be anything. Again, could be pain, but it could be someone who's being treated for a malignancy with chemotherapy, and that the acupuncture has helped them with, nausea associated with that, or perhaps their anxiety because of this, and so forth. But once again, it's about the facilitating the patient's own ability to heal and have that agency in their lives. I'm really sorry, I'm a little bit distracted because there's a lot of commotion back here. I will, I think, leave it at that for now. I appreciate your patience.
And I think that as far as like the conditions that can be treated, I mean, it's the human condition. And when we look at kind of the world heritage of traditional medicines, you know, there are systems of medicine all around the world. One of the most kind of pronounced and most popularized internationally is acupuncture and East Asian medicine. And so, you know, for the conditions, whether we're really just treating the human condition or specific maladies such as pain, and pain is really the one where there's most research for acupuncture and the treatment of pain. But what we should remember about pain, and I'll kind of add one of our East Asian medicine adages, which is, you know, when there's not the, or when you don't have the free flow of blood and qi, and this is really, you know, our blood, then you're going to have pain. And that makes sense to everyone. You know, if you lose a little circulation in your finger, tying a string around it, it hurts. And when we're really looking at about our whole system, that, you know, that circulation and blood flow is where we get the benefits from exercise and things as well. It's really important, and acupuncture plays a really good role in that and helping to get things moving. And so the other side of that adage is, you know, when there is free flow of blood and qi, then there is no pain. But when, you know, things are circulating, the whole system is working properly, you're not really having many of the chronic diseases that we have associated with aging or standard American diet or other things like that when we treat our bodies right. Acupuncture can help us kind of disentangle the effects of the modern world on us, and I think it should be used that way. But I will say, you know, we think Acupuncture Medicine Day that it just ends with the needles or the tip of the needle, but it really is including the nutritional, dietary, the movement, the stress management. So it is kind of all of these therapies that we've combined. So we have acupuncturists now at the VA, but we also have our Tai Chi and Qigong and mindfulness and guided imagery, among other therapies. And really you combine all of those and start getting closer to again, that public health medicine that was the traditional medicine of East Asia. It includes cupping and moxibustion and Chinese herbal medicine, as well as those other herbal traditions. And so it is really combining, looking beyond just the point of the acupuncture needle and looking at it as, okay, a way of life and a way of healing. And so I think that kind of sums it up for me.
Well, that was absolutely fabulous conversation. And I want to thank Dr. Fennell and Dr. Lee for taking the time to share such valuable information with us. And I also want to thank you, the audience, as well, for taking the time to listen. Stay safe and healthy, and thank you.